Hey y'all, Kayla Mowdy, Doctor of Physical Therapy. Today, for our Monday educational moment, I'm going to talk about the TMJ. So, temporomandibular joint. It is a joint, so yes, physical therapists do treat this. We actually are allowed to take orders from dentists for this problem. So, if you have TMD, temporomandibular dysfunction, clicking, popping is the first stage of temporomandibular dysfunction. Usually we advise people to quit chewing gum. Extra activities like clenching is advised to be avoided. What you can do during the daytime to avoid that is kind of tell yourself lips together, teeth apart. So actually when you are resting, doing a task, your teeth should actually not be touching. So that's my free piece of advice today. So everybody check yourself. Are your teeth touching? You're probably clenching, which is activating the masseter muscle and the temporalis muscle, which can lead to trigger points in these muscles and pain, even headaches, jaw pain. So the second stage of temporomandibular dysfunction is when the clicking and popping stops. So there's a disc in there that helps everything roll and slide and glide nice and smoothly, but after a long period of time, if you have the clicking and the popping, sometimes that little disc gets frayed, displaced, stretched out, just not performing well, so then it doesn't slide back in like it's supposed to, and that's when you have that lock jaw type of problem. So all of those things can be treated with glides, similar to what we do in other joints. Even in the spine, we do some like gliding of the joints together to make them feel better. We can do that same thing here in the jaw. The difference is we have to put gloves on and we have to stick our hand in your mouth, which is, sometimes uncomfortable, but it's completely normal to me. I'm okay with that idea. I've actually been assessing the TMJ a lot with my neck pain patients because it is right there together, a couple inches or an inch away really. And the muscles that control this can sometimes also work together with those, and that's a thing that physical therapists have expert knowledge in. It is kind of a specialty area. Not all physical therapists are comfortable with sticking their hand in your mouth, and I encourage you, if you are watching this and you are a physical therapist, to pursue some education so that you are comfortable with that, because the last thing this profession needs is a dentist sending us someone with TMJ and us to turn them back around and say, sorry, we don't treat that, because we do. We know how that works and how to make it feel better. So if you're struggling with this, try the teeth, lips together, teeth apart for resting positions. Opening your mouth can be some stretches and stuff, but that gets a little hairy and you need some guidance with those stretches and glides and getting that going. It can be both sides. Some people just have one side dysfunction. All those are things we can assess with different tests and measures. Hope everybody's having a wonderful Monday. Remember, don't clench those teeth today as you go about your day. And relax your shoulders too. That hopefully will help you have a good Monday. Bye.